Our testing happens with the help of two different types of technology. One is called the TrueNat screening test, and the other is the RT-PCR confirmatory test. The TrueNat screening test is the first test that we use for the people who are coming by rail, for the people who are coming by road. We first take them, if they are coming through the North Goa district checkpost, we take them to our Asilo hospital where their swabs are taken. Similarly, if they are coming through the checkpost of South Goa district, they are taken first to our Hospicio hospital, their swabs are taken. After the swabs are taken, they are immediately moved to our quarantine centers, the various residencies, you are aware of that. And then the testing is conducted using the TrueNat screening test. Now, if a case comes positive in the TrueNat screening test, the protocol as prescribed by ICMR is that it has to be sent for confirmation test at the RT-PCR lab. Our RT-PCR lab for the state of Goa is our lab at Goa Medical College. So only after the confirmation happens at Goa Medical College do we declare a case as confirmed. This is the protocol nationally followed. Now, the labs that we have, apart from our virology lab in GMC, which is the only lab for confirmatory test, but the labs where we are doing the screening test are Asilo, Ponda, Asilo as district hospital, Ponda sub-district hospital, Chikalim cottage hospital, Hospicio district hospital. These are the 4 labs where our tests are going on. As I mentioned to you, because of the need to test each and every passenger who is coming in by rail, by road, by air, we have literally started functioning all our labs 24/7. Swab collection already had begun 24/7, but now we are also doing the tests through the night, through the day, 24/7, in shifts, of course, of the lab technicians. I would like to mention once again that there are no rapid tests being done in Goa at all. In fact, rapid tests have not been prescribed by the ICMR. There was initially a strategy, but then ICMR issued clarification that rapid test kits are not to be used, and we are not using any rapid test kits. Rapid test kits are the blood sample based test kits which give you the result in 5 minutes or 10 minutes. We have not used a single rapid test kit. Right from the beginning of COVID crisis, not a single rapid test kit has been used anywhere in the state of Goa. The protocol that we have followed for train passengers, just a couple of words on that. You know that we had 2 trains which had come in, Rajdhani trains on Saturday and Sunday. Apart from this, of course, we have trains coming every day. Every day we have trains which are not terminating in Goa. They pass Goa in transit, but the last 2 trains which terminated in Goa were the Rajdhanis which came on Saturday and Sunday. Now the protocol that we followed for that is each and every passenger's swab was taken at Hospicio hospital, and then they were shifted to quarantine. Now, depending on the results of the tests, we have been discharging the people. We have been allowing them to go on strict home quarantine of 14 days. For the air passengers, the protocol is quite similar. Today was, of course, our first aircraft which came in specifically with passengers. You are aware that we had 417 passengers who came in. Details, of course, will be shared by my colleague. I am only explaining the protocol. The passengers who come, we screen them. We take the swabs at the airport itself through our smart kiosks which have been installed in the airport, as well as our other teams of paramedics as well as doctors who are deployed there at the airport. Swabs are taken and they were tested. They are being tested in both Chikalim and Hospicio labs. And then as soon as the swabs are taken, then they are shifted to the paid quarantine facility that they themselves have chosen. So in this case, since they came as a group from Italy, therefore the company itself has decided which are the paid quarantine facilities for them.
Excuse me, ma'am.
Yes.
Those swabs are taken for TrueNat testing or?
The swabs are taken for TrueNat testing when it is used for screening. These are the passengers whom we are screening through TrueNat.
So yes. At the airport also you are doing TrueNat?
Yes, we are taking the swab to test it using the TrueNat technology. When we send it for confirmation, if at all we get a positive result in the lab, we have to take a fresh sample and then send for confirmation to GMC lab. I would also like to just mention about our preparedness at the ESI, the COVID hospital. We had 100 beds to begin with at the COVID hospital. Ever since we started having fresh cases, we have increased our capacity to 170 beds. So to that 100, we added 70 more beds. And now our plan is to increase it by further 50. So the target is 220 beds. 100 plus the 70 plus 50, 220. 170 beds are ready. We are planning to increase it to 50 very soon. There are sufficient ICU beds and oxygen beds. The Government of India, Ministry of Health and Family Welfare has asked us to pay equal emphasis and in fact more emphasis on availability of what is called oxygen beds. Beds which can have oxygen cylinders attached to them so that the patient can be given immediate oxygen supply. The experience around the country and the world has been that the first option should be to give them oxygen supply. Only if that fails should we shift the patient to ventilator. We also have a dedicated pediatric ward at the COVID hospital. And our team from ESI hospital, from our DHS, the district hospital of South Goa, Hospicio Hospital, and our consultants from GMC are all part of the COVID management team at the COVID hospital. To ensure the safety of all the staff, from police, from revenue administration, from the various departments who are manning our border posts, as well as those staff who are helping out every time we have arrival of trains and the aeroplanes, we have taken a decision to provide face shields. You know that face shields have been already used by quite a number of people who are involved in COVID management. It's an effective measure of social distancing as well as safety. So we will be providing, we have already in fact gone ahead and placed the order with the approval of the State Executive Committee for 500 face shields for the personnel of North Goa district and 500 face shields of the personnel of South Goa district.
Today we had 2 flights which have already landed from Italy. They carried 168 passengers each. Third flight is expected to land at between 9:30 to 10:30. So total 417, as ma'am has said, seafarers would arrive in Goa, and after the testing they have been shifted to the quarantine facilities as has been advised by the MHA guidelines. Regarding movement of trains and migrants, I want to share with you that since 29th April, 3,847 people have arrived in Goa and 32,860 people have left Goa. By 11 trains which we have sent, around 13,448 passengers have gone to different states. 3 trains have gone to MP, J&K, 2 and Himachal Pradesh, Uttarakhand, UP and Chhattisgarh. We are making all possible arrangements to facilitate the movements because these are friends who now wants to go home, and we are facilitating it as much as possible.